Hello, welcome to another podcast of Health and Community. Today we have the pleasure of having Dr. Joanny Atkinson. She's a professor from Baylor College of Medicine, and we are doing the interview in English, but you are going to hear the interview in Spanish because of the magic of artificial intelligence. So, Dr. Atkinson, thank you for coming to this podcast to talk about maternal health.
I want to thank you for the opportunity. I'm very happy to be here on behalf of the Department of Family and Community Medicine at Baylor.
Great. Yes. So today we're going to talk about high blood pressure and pregnancy. So how can you define or can you explain to us what is eclampsia and preeclampsia?
Yes. So, first, I'm going to start by explaining what is preeclampsia. Preeclampsia is a condition that can occur among women who are pregnant. It can occur starting at as early as 20 weeks during pregnancy and as late as 6 weeks after the mother delivers. We diagnose someone with having preeclampsia if they have a high blood pressure and if there's any evidence of damage to certain organs in the body. Especially, we look at the kidneys. When you have preeclampsia, we may notice that your kidneys are not working exactly as they should, but it also can affect the liver, the eyes, and the brain.
So, and then what are the signs or symptoms for the pregnant woman?
Uh-huh. So when you have preeclampsia, because it can affect the kidneys, one of the things we may see is the doctor, when you go, they always take a sample of urine. So one of the things they're looking for are there any signs of kidney damage in the urine? So we look for something called protein. Some women may not have any signs of preeclampsia, and so we always like to start with measuring using certain types of tests. Because it can affect things like the liver, women may start to notice that maybe they start to have swelling in certain parts of their body, like their hands, their face, their legs. They may also start to notice that they have some tenderness in the place where the liver is located, which is the right upper part of the body. Because it can affect the eyes, they may start to have some changes in their vision. Their vision may become more blurry than normal, or they may start to see things a little bit differently. Um, and in the worst case scenario, if it starts to affect the brain, women may start to complain of headaches, or they may start to feel a little more confused or different.
And so that is also stress out the importance of prenatal care, no? So you say at 20 weeks, go to the doctor because the doctor is going to be looking at those signs and symptoms.
Exactly. So that's why prenatal care is so important. And I want to go back to the first question that you asked me about preeclampsia and eclampsia. Preeclampsia, we talked about, but if you have signs of preeclampsia and it's starting to affect the brain and you start to have seizures, which is something that could happen in a severe case of preeclampsia, we give that a different name. We call it eclampsia. So I wanted to make sure that I addressed that question because it's really important. Going back to prenatal care, I cannot say enough about how important it is to get prenatal care and to get it early. One of the things you'll notice is every time you go into your visit, the doctor will check your blood pressure and they'll take a urine sample. They're looking for early signs of things like preeclampsia. So,
Yes.
yes.
And talking about that, no, because there are many people here in our neighborhood that they don't have health insurance, but I think it's important to tell them that there are ways in which they can go to different organizations like the Balbona Clinic here in or Legacy and others in which they can get a health insurance, and if they are pregnant, for a while until they at least until they deliver. Is that correct?
That's absolutely correct. We have programs, particularly if you live in the Houston area or what we call the Harris County area. You could very well have access to the county clinic where I work that can provide prenatal care. Um, it does not matter what type of work you do, where you're from, as long as you could show proof that you live in Harris County or the Houston area.
Perfect. And that would be just an invoice from the electricity company, for example.
Exactly. So maybe showing a bill. There are other just very basic paperwork that you could show that would allow you to have access to our clinics.
Perfect. So they can go to other these organizations, and if anybody have questions, you can ask us at the Golden Home Community. We will direct you where you can go. And what are the risks of having preeclampsia?
Yeah, so there's certain things that could put you at risk for having preeclampsia. One is if this is your first pregnancy. Another is if you're pregnant with more than one baby. So maybe if you're having twins or if you're having triplets. Another one is if mothers in your family have had the condition before. Also, if you have high blood pressure before you get pregnant, or if you have diabetes even before you get pregnant, those things could put you at a higher risk for having preeclampsia. Other things to think about is if you are very overweight, that may put you at a higher risk. And there's one other thing I wanted to mention that could put you at higher risk for if you have other medical conditions, maybe you have a condition called lupus or what we call autoimmune diseases, that could also put you at higher risk for having preeclampsia.
I see. And is there any way in which can be prevented?
So, some of the things that you could do that may help reduce your risk of having preeclampsia is one, starting with a healthy lifestyle. So, working with your doctor to have a healthy diet, to have a healthy exercise routine. Two, as I said before, getting your prenatal care early. So that way you could start working with your doctor to help monitor for any conditions that may occur during pregnancy. If you have high blood pressure or diabetes, it's really important that even before pregnancy, you try to make sure those conditions are very well controlled. Um, and another benefit of prenatal care is that if your doctor thinks you might be at risk of developing preeclampsia later in pregnancy, they may also consider starting you on a baby aspirin once a day early in pregnancy around 12 weeks, which has been shown to significantly reduce your chances of getting preeclampsia during the pregnancy.
So, as usual, eating healthy, doing exercise is the magic solution, not solution, but at least helps to prevent. And the other thing, which is extremely important, is go to your doctor to get your prenatal care.
Definitely. And I always have to throw this in here, even though I know many of our pregnant mothers don't do this anyway. But avoid smoking and avoid alcohol use because those things also reduce your risk.
And the baby.
Yes. It creates for a healthier environment for both the baby and you.
Yeah, no. And also what we call secondhand smoke, not that we may. So if someone smokes at the home, but he or she can go outside to smoke. No,
Yeah, thank you so much for mentioning that. Secondhand smoke is really important. And I often will tell my mothers that you want to avoid being around people who smoke. And if people do smoke, you may even want them to change their clothes. because you could still have smoke that's embedded in your clothes. So if you hug that person or if the kids hug that person, they may still breathe in some of that smoke.
Okay, thank you very much. Is there anything else that you would like to tell us?
I just want to say thank you again for this opportunity. And if you don't remember anything else, please, please, please start your prenatal care early.
Okay, that's the best way to end this podcast. Go and get prenatal care. Is in many cases it will be free.
Yes,
Thank you very much, Dr. Atkinson.
you're welcome. Until next time.
Bye. Until next time.
Mhm.